Hello, my name is Nicolas Withey, and this is my study. Is it common to have a mental illness and not be diagnosed? There are a lot of negative stereotypes about people with a mental illness, and these negative stereotypes have contributed to the underfunding of mental health services, according to one study primarily focused on the fixing a mental illness stigma by Eisenberg and his colleagues. The underfunding of mental health services, as well as the mental health stigma, are both good reasons as to why people may go without ever seeing a therapist or even taking a legitimate mental evaluation test. There was one study that had willing participants fill out a quick test called the Mini International Neuropsychiatric Interview, when patients with non-psychiatric complaints would come into the ER. The results showed that 45% of the participants tested positive for a mental illness, and because of the mini test, any patient with a mental illness was able to receive the proper treatment for their diagnosis. Having a mental illness is a very normal thing, and most commonly can be treated and still allow the individual to live a normal life. However, individuals who go undiagnosed and untreated for a serious mental illness are not able to live their best lives. The purpose of this lab was to take a look to see how common it is for individuals to have a mental illness without being diagnosed. The participants of this study included 219 people chosen by undergraduate students for a survey ranging from ages 18 and up, with an even mix of both male and female participants, and one person who chose the other category. For this study, a chi-square test was used to gather the information of male and female participants to see how many participants scored highly on the Psi-90 test who were diagnosed, and how many participants with a high score on the Psi-90 did not have a diagnosis. Students enrolled in undergraduate psychology courses were given an extra credit opportunity where they asked friends and family to complete an online survey. They were instructed to find some participants who were not college students in an effort to diversify the sample. They were also instructed not to ask anyone who was less than 18 years old. The survey took less than approximately 15 minutes to complete. The results were the asymptotic significance was 0.074 of the chi-square test, indicating that the number of undiagnosed individuals with high scores was not significant enough to show that it was common for people to go undiagnosed, or specifically males when compared to diagnosed females. To get these results, I made two groups. One group was of diagnosed males and females with high Psi-90 scores, and the other was of the undiagnosed individuals with high scores on the Psi-90. And with these groups, I ran a chi-square test. Through this study, it was determined that the number of males compared to females going undiagnosed was not significantly large enough to be considered common, and the total score for expected diagnosed compared to the actual diagnosed count was not far enough off to make any conclusions onto whether or not it can be considered a common occurrence that people who would score highly on a test like the Psi-90 would go undiagnosed. As shown in the study of the undiagnosed mental illnesses in the emergency room, only 45% of participants who had not yet been diagnosed scored highly on the mini test and were determined to have one of the more common mental illnesses such as depression. But this still shows how beneficial taking a test and knowing for sure if an individual has a mental illness can be. The article about the study of the mental health stigma helps to emphasize why some people may not want to be diagnosed and how exposure to the reality of mental illness cases can be beneficial. Overall, the study did not produce sufficient findings in a broad search to determine just how common it is for adults to go undiagnosed with a mental illness, but the lack of results may also show that more people are getting the mental care they need. And this is my reference page. Thank you, and that was my study.